Hi, my name is Isabel Mosery, and I am a second-degree nursing student at Fairfield University. Today, we're going to be talking about blood pressure, and I just want to begin the lecture by showing a quick video.
Blood pressure. Blood pressure is created when the heart pumps blood through the blood vessels, and the blood pushes against the walls of the blood vessels. Blood pressure helps move blood through the body, so each part can get oxygen. Healthy arteries, the blood vessels that carry oxygen-rich blood from the heart to the rest of the body, stretch to allow more blood to push through them. How much they stretch depends on how hard the blood pushes against the artery walls. It's important for blood pressure to be within a healthy range to help the arteries stay healthy. Blood pressure can be found using a blood pressure monitor and is recorded as two numbers. The systolic pressure, the upper number, is how much pressure is exerting on the artery walls while the heart is pumping blood. The diastolic pressure, lower number, is how much pressure blood is exerting against the artery walls while the heart is resting between beats. High blood pressure usually doesn't have a cause, and many people don't have symptoms. Sometimes it is even called the silent killer for this reason. There are some risk factors in developing high blood pressure that can't be controlled, like family history, age, gender, and race. Whereas there are some that can be controlled, like lack of physical activity and an unhealthy diet. High blood pressure, if not treated, can cause the heart to get bigger because it must work harder to supply the blood the body needs. It can also lead to many serious heart and health conditions. Blood pressure can be controlled by limiting sodium intake and eating healthy foods like fruits, vegetables, whole grains, low-fat protein sources, and low-fat dairy products. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
Okay, so that was a nice video put together by the American Heart Association on the importance of being aware of your blood pressure reading and how that affects your overall health. Now we're going to go into a slideshow about the role of food in your health in terms of blood pressure. Excuse me. So the learning objectives for today is to understand how food affects your blood pressure, describe what causes high blood pressure, and identify at least two strategies for controlling your blood pressure. So how does blood pressure work? When your heart pumps blood through the blood vessels, this blood pushes against the walls of the vessels and it expands them. This pushing creates blood pressure. So blood pressure is what allows the blood to move throughout your entire body. And when blood moves throughout your entire body, it's providing your organs and your tissues the necessary oxygen needed to survive. So once again, we need blood pressure to move the blood throughout our bodies so it can provide our organs and tissues with the oxygen they need. Healthy arteries, the blood vessels that carry oxygen-rich blood from the heart to the rest of the body, are elastic. They can stretch to allow more blood to push through them. How much they stretch depends on how hard the blood pushes against the arteries. For your arteries to stay healthy, it's important that your blood pressure is within a normal healthy range. For some of us, blood pressure can get too high, and this is called hypertension. Blood pressure is measured with two numbers, the systolic pressure, which is the top number, and that measures the pressure in the arteries when blood is pumping, and the diastolic number, the bottom number, which measures pressure in the arteries when the heart is at rest. Once again, just reiterating, systolic is the upper number and diastolic is the lower number. So what's the difference between arteries and veins? Because both of these things play a very important role in blood pressure. Arteries move blood away from the heart. They're elastic and they can stretch. Veins move blood back towards the heart. So veins are deoxygenated, meaning they haven't been recycled through the lungs yet, while arteries are. So here's some instructions on how to take a proper blood pressure reading. I'm going to show a video of my blood pressure getting taken so that you guys can see a better example. One second. All right. So you can see in this video that the cuff is being placed around my arm and tightened. I also want to note that that gray wire that's connected to the cuff is supposed to be on the inner portion of your arm. That serves a purpose because it has a microphone which listens to your heart rate, and that way it can determine your overall blood pressure. So you want to take at least 2 readings 1 minute apart. You want to take your blood pressure in the morning before taking your medication and in the evening before dinner. And you want to log all of your results in a notebook so that when you go to the doctor, you can bring it and he has a sense of where your health is at. Another important thing to do is you want to use a properly calibrated and validated instrument. You want to make sure that the cuff size is right for you and that it's a nice snug fit. You also want to place the bottom of the cuff above the bend of the elbow, as you can see in the video. You want to make sure you're relaxed. You want to sit still in the chair with your feet flat on the floor and your back straight and supported. Try to rest in the chair for at least 5 minutes with your left arm resting comfortably on a flat surface at heart level, and sit calmly and don't talk. Also, before you get your blood pressure taken, don't smoke, exercise, drink coffee, alcohol, or any of those things within 30 minutes of measurement. So you just saw how to apply a blood pressure cuff and get the reading. And now we're going to go back to the slideshow. So this is everything that I just finished explaining. How to take an accurate blood pressure reading, what to do. Oh. Okay. So blood pressure has different ranges for different people. The normal blood pressure or healthy blood pressure is anything less than 120 over anything less than 80. So 120 over 80 we say is the perfect blood pressure. You know it's a little bit elevated when your systolic number, the upper number, is anywhere from 120 to 129 and your diastolic number is less than 80. Stage 1 hypertension is when people start to get a little worried. Hypertension is a word that scares a lot of people, and this is noted when your blood pressure is from 130 to 139 over 80 to 89. Stage 1 hypertension. Stage 2 hypertension is a reading from anywhere from 140 or higher over 90 or higher. And hypertension to stage 3 is a hypertensive crisis, and this is when you should seek medical emergency. It's anything higher than 180 over anything higher than 120. So if you see a reading that's higher than 180 over higher than 120, it's very important that you go to the hospital and seek medical attention. So hypertension is called the silent killer because it doesn't have side effects. People don't feel symptoms. They don't feel as though something is wrong for them to go to the doctor. However, there are some risk factors or conditions that can make us more likely to develop high blood pressure. Some risk factors are outside of our control. They're non-modifiable. There's nothing we can do to prevent these things. And this slide explains those factors. So the things that are in the gray circles are things that are out of our control that we can't fix. Family history. Does your mom have high blood pressure? Does your dad have high blood pressure? Do your grandparents have high blood pressure? All these factors are very important in determining whether you're at higher or lower risk for having hypertension. Another risk factor is age. As we get older, our blood vessels and arteries, they become weaker, and that gives us a higher chance of developing high blood pressure. Another risk factor is gender and race. But along with these things that are out of our control, there are a lot of things that we can do to improve our overall health. Being aware of how much alcohol you drink, whether or not you smoke, your diet, your stress, and your physical activity are all things that can play into your overall health. So you want to make sure that in order to prevent hypertension, that you don't smoke, that you don't drink too much alcohol, that you have a healthy diet. We'll talk about that in a little bit. That you're controlling your stress levels in a healthy way, whether that's through meditation or breathing exercises, A lot of people aren't aware, but simple exercises like breathing exercises um, brings awareness to how you're actually breathing throughout the day. A lot of people don't notice, but throughout the day, they're just taking shallow breaths, enough to make them feel not out of breath. But if you sit down in a chair with your feet on the ground and you put your hand on your chest, you become more aware of how deep you're actually breathing, and shifting your focus from something super stressful to focusing on your breathing can really help lower blood pressure. So it's very important that when you go home at night, you decompress, you focus on your breathing, and then take your reading after and see if it lowered from your morning reading. So what happens when we have high blood pressure? In this picture over here, you can see that the normal pressure, the arteries have enough room to let the blood flow freely. However, with hypertension, there's a damage to the inner lining of the arteries, and that can make the blood picture like a circle, right? This is a normal circle, but when you have hypertension, the blood vessels become thinner. And when they become thinner, it's harder for the blood to pass through. And this leads to an increase in pressure throughout the body. And eventually, you're going to have a buildup of plaque when there's so much pressure. This can increase your risk of heart disease. It can increase your risk of stroke. And that's why it's very important to prevent it early. This diagram here helps you identify symptoms of a stroke. So, spot a stroke, learn the warning signs, and act fast. So, there's a nice little acronym that people use, be fast. The B is for balance. Does this person have loss of balance? Are they suffering from a headache or dizziness? The E stands for eyes. Do you have blurred vision? This is a sign of stroke. Next is F, face. When you ask the person to smile, is one side of their face drooping? Is one eye lower than the other? The next is arms. Ask the person to lift both of their arms. If they can only lift one or one falls down, that can be a symptom of a stroke. Do they have numbness and tingling in their arm? That's another very important sign. The S stands for speech. Does this person have difficulty speaking? Do they sound like they're speaking in gibberish? Are their words slurred? That's very important. If you see all of these signs, the balance, the eyes, the face, the arms, and the speech, this is a good sign for you to call the police and to get immediate help. This diagram over here explains the complications of hypertension. You can see on the bottom that with normal blood pressure, the vessel is more opened. But as you go towards having hypertension, higher blood pressures, the vessel gets more and more narrow, making the blood harder to pass freely. So some of the complications of high blood pressure are vision loss, something called hypertensive retinopathy, which is damaged blood vessels in the retina, resulting in loss of vision. Another thing is a brain stroke. Reduced blood supply to the brain leads to rapid loss of function or stroke. Because it's hard for the blood to pass through these narrow vessels, the body isn't getting enough blood where it's supposed to go, and that can cause a stroke. A heart attack is another complication of hypertension. Hypertension causes the heart to pump against high blood pressure, making it work harder than necessary. Over time, this causes the heart muscle to thicken, restricting blood flow, which can lead to heart failure. Another complication of hypertension is kidney failure. Damaged blood vessels in the kidneys can't effectively filter your blood, resulting in dangerous accumulation of fluid and waste. So we all know that the kidney's job is to filter the toxins from your blood and make sure that the blood that's going throughout the body is clean and pure. But if you have damage to the blood vessels in the kidneys, they can't do a good job at filtering, and there'll be more waste scattered throughout the blood in your body. Very dangerous. Another complication of hypertension is something called blood vessel damage or atherosclerosis. Hypertension is a leading cause of atherosclerosis, the artery narrowing process that can result in heart attack or stroke. So as you see in the picture below, as the vessels get more narrow, they have built up a plaque, and this can result in a heart attack or stroke because the vessels are narrowing and not enough blood is passing through. Another complication of hypertension is bone loss. High blood pressure may increase the amount of calcium in your urine, and that excessive elimination of calcium may lead to bone loss or density. Bones are made out of calcium. That's what makes them strong. So if you're losing calcium in your urine, your bones are going to get weak. You're going to have loss of bone. That's why all these things make it very important for us to be able to control our blood pressure, monitoring it every day, and making sure that you're taking the right precautions. Going to the doctor if you have high blood pressure, taking your medication at the right time every day. All of these things are very important. So this slide over here shows some signs and symptoms of hypertension. Although it's called the silent killer, there are some things that could be noticed. So things like having difficulty breathing. Are you breathing normally? Are you breathing more or less than normal? You should pay attention to these things. Do you have an irregular heartbeat? Do you get severe headaches? Try to drink water. If the water doesn't help, then it might be a hypertension. Are you experiencing memory loss or confusion? Do you feel tired or weak more than usual? Do you have blurred vision? Is there a pounding in your chest, neck, or ears? All of these things are signs that you should go and have your blood pressure checked out and see a physician. So now we're going to talk about some tips on how to improve your blood pressure. One of the main things is having a heart healthy diet. So eating fruits and vegetables, whole grains, and lean meat. A lot of people like to buy their fruits and vegetables in cans, and this can be very dangerous for your heart because a preservative that's put in canned foods is salt, and salt is very bad for your heart. So instead of buying, if you want foods to have a longer shelf life, it's better to buy them frozen, or fresh if you're not concerned about that. Whole grains, so like whole grain pasta as opposed to regular pasta. Lean meats. Another thing that you can do is to limit the amount of sodium. Eat less salt. So once again, most sodium comes from eating packaged and prepared foods, and by limiting sodium, you can keep your blood pressure in check. So here are some popular high sodium foods. It's very important when you go to the supermarket that you look at the nutrition labels and you see how much sodium everything has. So you want your sodium to be from anywhere between 120 milligrams to 140 milligrams. Anything outside of that range can be considered bad for your heart and bad for your blood pressure. So some popular high sodium foods are breads and rolls. Once again, when you go to the supermarket, you see that there's so many different options for breads and rolls. Just make sure that you take the time to check the nutrition label and check that sodium. Another thing is pizza. When you add meats to pizza like pepperoni or sausage, you're adding a lot of sodium, so you can have a healthy substitution like veggies instead. I know a lot of people like to eat sandwiches. The cold cut meats in sandwiches are actually very high in sodium. So what is recommended to do is to eat a side salad first so that you get full and you get your daily intake of fruits and vegetables and fiber, and then eat the sandwich and only eat half of it. And this can lower your sodium levels significantly. 3 other things that are high in sodium are cold cuts and cured meats. So when you're shopping for brands in the supermarket, just take a minute to glance at that sodium level again. Another thing is soup. Because it's canned and it has a longer shelf life, they put a lot of preservatives like sodium to make sure that it lasts longer on the shelf. So that's very bad for you. You want to stay away from that. Check the nutrition label for which brand has the lowest sodium. Another thing that people really like to eat, I personally love to eat this, is burritos and tacos. Burritos and tacos, they say that one package, which is 2 teaspoons of taco seasoning, can have as much as 430 milligrams of sodium. This is almost 4 times the daily recommended amount. So another thing that you can do instead of having these 2 teaspoons for 430 milligrams is you can make your own taco seasoning. And I wrote down on the bottom how you can do that. You just take half a teaspoon of cumin, oregano, chili powder, and garlic, and you mix them together and you have your own seasoning. And when you do that, instead of doing the 430 from the store bought, yours, the one that you just made, has only 42 milligrams of sodium. So it's a very good alternative, very much healthier. Another thing that I like to eat is tomato basil soup. This is very low in sodium, and I can show you how to make it. There's a recipe that the American Heart Association posted that shows how to make it in a heart healthy way. So we can play that video right now. Reiterating the salty six, the breads and the rolls, the pizza, the sandwiches, the cold cuts and cured meats, the soups, the burritos and tacos. You want to make sure that you're checking the nutrition labels for sodium less than 140 to 120. So what's one way that we can control your hypertension? We can set goals. You want to make sure that your goals are specific, they're measurable, achievable, relevant, and time-based. So instead of saying that you're going to check your blood pressure weekly, try saying, I'm going to check my blood pressure every Wednesday morning. That way you're giving yourself a time frame. It's a smarter goal. When you're setting these goals, you also want to ask yourself, what is it that I want to accomplish? How will I know when I've reached my goals? How can this goal be met? Will this goal help me reach my long-term goals? And when will this goal be met? So this diagram talks about how to manage your blood pressure. In the middle, you can see that a healthy reading is anywhere from 120 over 80, around that area. It also lists the blood pressure categories, all the stages of hypertension. Once again, a hypertensive crisis is anywhere with the blood pressure higher than 180 over than a number higher than 120. And this is when you have to call your doctor immediately and seek medical help. So things that you can do to track your levels is to check your blood pressure every day, change your diet, and control your medication. If you're on medication for hypertension, like lisinopril or any other medication, it's very important that you're following the routine, that you're taking them as ordered. So when I was in clinical, a lot of the people that came to get their blood pressure taken were saying that they were on blood pressure medications, but that their lives are too busy for them to keep up with the regimen. So some days they forget because they're working part-time and sometimes they're working overnight, and they don't have a set routine where they can take their medication every day at the same time. So it's important to use your resources. If you have a cell phone, set an alarm and remind yourself to take your medication, because if you don't, then it can lead to a lot of complications that you don't want. High blood pressure is very dangerous. It's more important to control your levels than to have to take off from work for a week because you're in the hospital. So some tips for success are to eat smart. You want to eat a diet that has a lot of fruits and vegetables, whole grains, beans, nuts, plant-based proteins, lean protein, and fish. You also want to, once again, I can't reiterate enough, limit the amount of sodium that you eat. Try to stay away from saturated fats and sugars. Limit sugary foods and drinks, fatty or processed meats, salty foods, refined carbohydrates, and highly processed foods. So just once again, be more aware of what you're putting into your body, because it could be very harmful. Treat your body like a temple. Move more. Physical activity can help control blood pressure, weight, and stress levels. So if you can move around more, whether it's walking to the supermarket or taking your kids to the park, getting out and walking for 15 minutes can have a very significant impact on your health. Managing weight. If you're overweight, even a slight weight loss can reduce high blood pressure. Another thing that negatively affects your blood pressure is smoking. Every time you smoke or vape or use tobacco, the nicotine can cause a temporary increase in blood pressure. Another thing that you want to make sure that you're doing is sleeping well. Short sleep, which is considered anything less than 5 hours, and poor quality of sleep are associated with high blood pressure. So there's been a lot of trends where people who sleep more and get more quality sleep tend to be less stressed and have better blood pressure levels. All right, thank you so much.